With the 2018 year now behind us, everyone at Alameda Health System should take a brief moment to pause and enjoy some well-deserved satisfaction for all of the hard work that we achieved. Collectively, we made significant strides to improve the quality of care for our patients and our community. Right now, I am sitting in our state-of-the-art simulation center that was opened just last year with the help of our foundation. Here are some other major milestones that we accomplished in the past 12 months.
So I think, as we all know, every single one of us who works here at AHS is here to provide the best patient care possible. And unfortunately, we haven't always had the tools or resources to do that or know how we're measuring on various quality-related metrics. So Prime has given us that platform, and I'm so proud of every single person who's worked to achieve the success that we have in Prime for the last year. We hit over 90% of our metrics, recouped 100% of the funding that was attached to the Prime for this year, and most importantly, improved performance on a number of different metrics, from diabetes to high blood pressure to depression screening to substance abuse screening and treatment across all of ambulatory. But I think patient stories speak the loudest, so I wanted to share one patient story from my own clinic. My medical assistant and our eligibility staff, who screen our patients for depression at every single visit, completed a screener on one of my patients that I've been seeing for years and years. This elderly woman also has diabetes, which is what I usually focus on, and it was only that positive screen that led me to ask her, how are you feeling today, and how are you coping with your illness? And she burst into tears, and we were able to get her a warm handoff with our behavioral health staff. We were able to get her started on treatment, and I'm really proud to say her depression is really well controlled right now, but it's something that I had certainly missed, and we probably wouldn't have picked up without that team effort and the Prime goals that we were striving to meet.
Back in January 2018, the Alameda Health System Board approved what we now call Project Sapphire, which is a revitalization and transformation of our EMR. At $200 million is the largest project that we've undertaken as an organization. The Sapphire project is going to transform and touch every part of our organization. It has already started doing that. We have over 120 certifications from the Sapphire team already completed. We've had over 1,000 people involved in the adoption setting phase of the project. We're 100% staffed on the project, which is a huge undertaking, and I'm very pleased that we just completed our build phase of the project on time and on budget. Internally, it's going to make us much more efficient with the work we do, helping guarantee our sustainability into the future. With our patients, the new medical record is going to allow us to see complete and comprehensive medical history on our patients and be able to predict better courses of care. It's also going to allow our patients to become an integral part of their own medical record and their own medical care, which is an important trend in our society and in our industry.
2018 was a year of change. I could not be prouder to be part of an organization that continues to demonstrate a commitment to excellence in clinical quality and patient care for the communities that we serve. Through those changes in workflows, in policies, and processes, we continue to see improvements in quality, in care delivery, and access. Another critical change for the organization was our effort around clinical standardization for excellence, or better known as CS4E. Under clinical standardization for excellence, we looked at all of our policies across all of our sites, looking at standardizing the care delivery. It should be no different when you're providing care or receiving care at one of our hospitals versus another. And this program and this process allowed us to do that.
2018 was a banner year for population health. We have been focused on three principal activities within the department. Improving care to our patients, making sure that we improve the outcomes, and using our funding efficiently to achieve both of those things. In 2018, we focused specifically on moving towards an alternative payment model for our primary care services. I am pleased to say that it was a collaboration throughout the department, particularly within our ambulatory care staff, our finance staff, our information technology staff, our business intelligence staff. And we successfully transitioned 3 of our wellness centers into capitation in 2018. Our final wellness center will be going live in capitation this spring. And when that occurs, 48,000 patients with Alameda Alliance will be capitated and will have us as their providers. I think this speaks highly to the great work that our staff did in 2018, and I am appreciative of all the efforts. So thank you.
When I look back at everything we accomplished together in 2018, it is incredible to think of how well we have positioned AHS to deliver care for the future. All of this progress reflects the commitment of everyone here at Alameda Health System, and I look forward to seeing the accomplishments we make in 2019.